Hi to everyone. This is Dr. Harsha, consultant endocrinologist from Harsha Diabetes and Endocrine Center, Bhimavaram. Today we'll be talking about hypertension. As you would have already heard that maintaining a normal and healthy BP is very much important, but you might not understand what exactly is blood pressure and what are the components that are involved in it and what we can do to maintain a good blood pressure. So basically what hypertension or what blood pressure is that whenever the heart beats, it pumps blood into the blood vessels. So and this pumping action, it creates a pressure inside the blood vessels, which is called blood pressure. So normally in healthy persons, it rises and falls throughout the day. But when blood pressure remains higher for a longer time and it is left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than the normal blood pressure is known as hypertension. So, and this high blood pressure, it usually develops over a period of time. And this can happen because of a number of reasons. Particular reasons include like unhealthy lifestyle choices, like not getting enough regular physical activity, or if the person is obese, or if the person is smoking or has a high alcohol consumption, or because of stress also, this hypertension can develop. There are also other risk factors which can increase the risk of getting hypertension. They include age. As the person gets older, the arteries will stiffen, and because of this stiffening, the blood pressure rises in elder individuals. And also family history also plays a major role in this. If one of your relatives or one of your family members has hypertension, there is a high chance that you might also develop hypertension in your older age. And also taking excess salt intake is also known to raise blood pressure. And also not eating enough foods with potassium can also increase your blood pressure. And it not only that, it also increases the risk of your stroke as well as chronic kidney diseases also. And eating processed and fatty foods, that are the junk food that is available, or the fast foods that are available to us, this also again it increases the chances of hypertension. And particularly these type of food, when they are combined with a lack of physical activity, they cause obesity, which further again increases the blood pressure. And another important thing is stress. If any work related or other family stress things are present, those also will increase your blood pressure. Moving on, hypertension, it doesn't usually show any obvious signs and symptoms. And because of this has been named as a silent killer. Even with other diseases, even simple diseases also, there are signs that are easily available, like diabetic patient will develop increased urination or some generalized weakness. Other diseases, you might get some fever or some signs, but this usually doesn't show any outward signs or symptoms. But the problem is that even though it doesn't show any signs and symptoms, it can lead to several severe diseases like cardiovascular diseases, kidney diseases, stroke, as well as kidney and eye damage also. And because of these consequences, it is important to diagnose hypertension in the early stage and treating the persons who are having it. If you see, generally, only a few patients will get some form of symptoms of hypertension. They can include morning headaches or tiredness, some blurring of vision, buzzing in their ears. Some might experience fatigue, nausea, or even vomitings also. And if a person experiences these symptoms, it is better that they get their blood pressure checked once. The fortunate thing is that once the patient is suspicious of hypertension, it can be easily diagnosed. It is usually measured by an instrument called sphygmomanometer, that is a BP machines that you might have seen. So it's a simple measurement, and it can be carried out and done anywhere also. And you might know that the normal and healthy blood pressure is 120 by 80 mm of Hg. What it usually represents is that the upper part, that is 120, what we are talking about, it is called the systolic blood pressure. It is nothing but the blood pressure that develops in the arteries when the heart pumps or when the heart beats. So whenever the heart beats, it creates a pressure in the blood vessels, which is the maximum pressure that is created in blood vessels. That's the systolic pressure. But once the heart relaxes in between beats, there is some residual pressure left over in the vessels. That is called the diastolic, or the lower number, that is 80 mm of Hg, that we'll be talking about. Once this number increases to more than 140 by 90 mm of Hg, it is known as hypertension. And once it increases above this, then the person is prone for more serious diseases like heart diseases or stroke or kidney diseases. So there are simple techniques or simple ways that we can reduce the risk of hypertension. The foremost thing is having a good and healthy diet, doing a regular exercise regimen, stop smoking, and having regular BP monitoring, stress management, and adherence to the medication if the patient is kept on any pharmacological medication. So if we consider these things one by one, so these regular exercise and physical activity is very important. And this is the primary thing that can prevent the person from going for a medication of hypertension. What physical activity does is that it increases the capacity of the heart to pump blood. So once the heart is healthy and it's strong, it can work effortlessly without increasing the blood pressure. So a person who has a regular physical activities and does a regular physical activity, the chances are that he will maintain a good blood pressure. And even as your age increases, if you have a good exercise regimen, it will prevent your blood pressure from increasing. And the amount of exercise that is required, again, it depends on your age and your physical activity. But we should usually aim for about at least 30 minutes of aerobic activity for most of the days in the week, up to 5 to 6 days in a week. And walking is a basic thing that we can do. And apart from that, brisk walking, jogging, and swimming also can be done. And after exercise, maintaining a healthy diet is very important. And the diet of these individuals should mostly include vegetables, fruits, and whole grains. There are several diets that are available to prevent hypertension. The most common thing is the DASH diet or a Mediterranean diet. And apart from that, what we can do is we can eat less saturated fat or a less total fat. And having plenty of potassium in our food also decreases the chances of hypertension. And limiting the amount of sodium in the diet. So if you see DASH diet, it is nothing but dietary approach to stop hypertension diet, which says that we should take food which is rich in whole grains, fruits, vegetables, and low in fat. And it has been shown that having a healthy lifestyle decreases our hypertension by up to 11 mm of Hg, which is quite significant. And apart from this, the other thing is reducing the sodium content in your diet. So this is the most common advice that we give to our patients is once you get hypertension, it's better that you reduce your salt intake. And reducing this salt intake can reduce our hypertension by about 5 to 6 mm of Hg. What we can do is we can go for an alternate low sodium alternatives, both in foods as well as beverages. And we can decrease our processed food intake. Most of the processed food, they contain a huge amount of sodium, and decreasing that is also important. And it should be remembered that even 1 teaspoon of salt, it contains about 2,300 mm of Hg, which is a huge amount, and it should be reduced. And instead of adding salt, we can add herbs or other spices to get a flavor to our food. And another important thing is stopping smoking. Smoking has a negative effect on the blood pressure. Not only on that, the overall endothelial function as well as cardiovascular function also is negatively affected by smoking. And stopping smoking will improve both your cardiovascular function as well as your blood pressure. And also monitoring your blood pressure is important. Since it's an easy function to monitor, regular checkup of hypertension is needed. The one obvious thing is you can visit a doctor near you to get your hypertension checked. Not only that, once you are diagnosed with hypertension or once you are started on medication, it is better that you maintain like self-monitoring of BP can be done even at your home also. These common sphygmomanometers are available even in shops as well as online also. So using those standard meters, you can self-monitor yourself. And whenever you find that your readings are abnormal, you can visit a doctor near you and you can change your medications or start on new medications. And the other important thing is stress management also. Both work and family stress also, they have a bearing on your blood pressure. And having proper stress management workouts are also important. Techniques like meditating or going on holidays or getting a peaceful exercise or listening to music also can help to a large amount in decreasing your blood pressure. And last but not least, adherence to medication is also important. So once a person is diagnosed to have hypertension and if a doctor prescribes him medicines for hypertension, it is necessary that it should be taken and it should not be stopped in between. Only if a doctor prescribes you to stop the hypertensive medicine, then only it should be stopped. Otherwise, it should be continued. So at last, I would like to suggest that there is nothing more precious than having a fit and healthy life. And adapting healthy lifestyle can help us enjoy a long and healthy life. And blood pressure is one of those things that can be easily prevented as well as controlled in many ways. So keeping blood pressure in the normal range is very important as it prevents several complications, particularly cardiovascular complications. And it is very much possible to maintain normal blood pressure levels with regular monitoring as well as preventive care. Thank you.